Diana is 42 years old. She has good volume in her lips, but she feels that her right upper lip has more definition than the left upper lip. So we're going to address that. Her second issue is she needs generalized volumization to make it look more youthful and more sexy. My favorite filler for lips is Restylane Kiss. It's specially designed for the lips because it gives a really nice structure and doesn't look too over the top. I have a slightly different way of injecting. Put the filler into a tiny needle. The reason for doing it is to minimize pain and to limit bruising, because if you bruise them, you will lose them. So I put the filler and just inject tiny. So this, you can see the difference between this needle and this needle. So another thing I always use before I do a lip injection is a numbing cream, just to numb, and then I also use my ice stick. This combination basically makes the procedure painless, because remember, if you make them feel pain, you will never see them again. In this particular patient, because she needs a general volumization, I have now measured her profile, which is actually really nice because the tip of her nose is touching her lower lip, which is also touching her chin. So that's a good profile. And her upper lip should be about 1 or 2 millimeters in front of the lower lip. So it's a little bit pushed back. So I'm first going to invert the lip a little bit, and then I'm going to project it forward. And in order to invert it, I always start from the top. There was a little bit of drooping, and you can see how this right commissure is going down and this one is a little bit up because I've added some filler here. But now I'm going to turn her frown upside down and have a look at the right.
Oh, wow.
Once you sit up.
That's crazy.
Right? And you can see that the left upper lip is a little bit more volumized than the right upper lip without looking like a duck.
They look so perfect already, that side.
Good. Basically try and massage it a little bit. I always tell my patients they will look a little ducky today, but then the swelling will go down by tomorrow. Post-treatment instructions are always no sauna, no jacuzzi, no vaccination for 2 weeks before and 2 weeks after, no dental work for 2 weeks or maybe 3 weeks post-treatment. And remember, your mouth is only for eating. I have basically volumized her lips. I've turned her frown upside down, accentuated her left upper lip border so it looks now more symmetrical. She's got a beautiful Cupid's bow and she's ready to party.